Joining us now, member of the Foreign Relations Committee, Democratic Senator Chris Murphy of Connecticut. Senator, you are vowing to try and punch back with this health care bill, offering, up to 100 amendments. Is it a delay tactic? Maybe devil's advocate question would be, wouldn't you want to try and make it better as opposed to muck up the process more?
Well, I'm going to offer amendments in sincere hope that they pass and that they end up making the bill better. I mean, the fact of the matter is Democrats have been shut out of this process. This has all happened behind closed doors. There's been no committee process, no hearings. And so the only opportunity that Democrats have to try to make this bill better is with amendments on the floor. Back in 2009, 2010, Republicans got to offer literally hundreds of amendments in the committee process. That didn't happen this year. But we have no idea what we're voting on. We may be shown the bill with only a few minutes before the final vote. So I don't apologize for the fact that we may have to offer a handful of amendments once the final bill is shown to us so that we can give some time for members of the Senate to understand what we're voting on and perhaps give some time for our constituents and the constituents of Republican senators to call in and try to stop this thing. This is absolutely unprecedented. And so I think it's okay for us to use some unprecedented tactics to try to figure out what we're voting on.
Casey Hunt.
Senator, I take your point that there were some differences in the process when the ACA was passed as to what is going on right now. But at the same time, this was pushed through with exclusively Democratic support in the end. Didn't you bring this on yourself to a certain extent and set up what are now these entrenched politics around health care?
Well, that's certainly what Mitch McConnell would like folks to believe, but there aren't some small differences between the process in 2009 and the process this year. There was a full committee process in which every Republican in 2009, 2010 in the House and the Senate got to see the bill ahead of time, got to offer amendments. The CBO score came out a month ahead of time. There was 30 days of debate in the United States Senate. This is total mythology, the idea that the ACA was rammed through. 30 days of consecutive debate in the United States Senate where the bill was out there for everybody to see. So this is not a small difference. This is a decision that's been made by Mitch McConnell to ram this through in the middle of the night. And let's just remind ourselves that as we sit here today talking, we have no idea what we're going to be voting on. They are going to unveil a bill in the middle of the night, tonight or tomorrow night, and ask senators to vote on a brand new bill that looks nothing like the bills that we've been seeing before with a couple hours notice. That bears no resemblance to the process in 2009, 2010. Yes, I wish we had Republican votes, but at least we went through an exhaustive process then to try to get them. They haven't done an iota of work to try to make this bipartisan.
Joe.
So, Senator, what happens next? Do you think the Republicans find 50 votes to pass a bill that's extraordinarily unpopular with most Americans?
I mean, what's going to happen is that they are going to throw a different bill up against the wall every probably 6 to 8 hours for the next few days and hope that one of them sticks. They tried the Senate bill last night, the one that they had crafted in these behind closed doors working groups. It failed miserably. 9 Republican senators voted against it. We hear that they will try later today to pass a straight repeal bill that Rand Paul wants. That will likely fail. And my worry is that Donald Trump and Mitch McConnell bully these guys into eventually delivering 50 votes. Now, that will be terrible for the country because it will likely be a bill that will uninsure 15 to 25 million people, but it'll also be terrible for them, too.
What does that bill look like, though, Senator? I mean, it doesn't seem like they're getting close to 50 on these votes for the actual bills. What does that bill look like that gets 50 votes?
So the scuttlebutt is that they are going to eventually offer a dramatically winnowed down version of the original bill, maybe only 2 or 3 provisions in the entire bill, and just punt. Just say, hey, listen, guys, we have to get a bill to conference with the House of Representatives, so let's just scribble down a few words and try to pass it off as a procedural vote, and we'll have the big negotiations in the conference with the House. That would be a total surrender and abdication to the House bill, and the result would be that in conference, the House bill with maybe a couple minor amendments would survive. And that bill, of course, is terrible for people with pre-existing conditions. So, that seems to be their only path now because they can't find 50 votes for any comprehensive replacement of the Affordable Care Act.
Eddie.
Senator Murphy, this is Eddie Glaude. A two-part question, really. What do you take to be the kind of animating commitment? I've been asking this question over and over again. The animating commitment behind the Republican bill. And second, what would it take for you to work in a bipartisan way with Republicans to fix the ACA, if we come to that?
Listen, at this point, I think it's clear that the animating commitment is a hatred of Barack Obama, right? The policy has been pushed to the wayside here. They don't seem tremendously interested in actually crafting something that insures more people or reduces rates. They just want to fulfill this commitment that they made to repeal Obamacare, and they don't seem to really care at this point what's on the other side of that. But I've been very clear about my desire to work with them and my desire to compromise. They want, as far as I can tell, flexibility of benefit design. They want something that has some cheaper premiums, less regulations in these exchanges. I'm willing to talk to them about that. I'm willing to give them some flexibility of benefit design if they're willing to give us some security on these exchanges that Donald Trump won't unwind them. There is a legitimate compromise to be had here, and I think Democrats are willing to bend, but they have to throw out this process and come and work with us in regular order, like John McCain told them to yesterday.
Regular order. Senator Chris Murphy, thank you very much.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.